Hi, I'm Taryn Tootin with the MedStar Health Digital Marketing Team. We're here at the MedStar Health Bel Air Medical Campus with a special event and a special announcement. So please sit tight, just a few more short moments and our program is going to start about a very exciting announcement that you will not want to miss. Thank you.
Did you coordinate it?
Hey, Mike, let's move everybody up.
Change positions, get in the audience, and turn around and listen. See what's going on. I'll stand with you, Bill, if you want to stay over here.
Well, good evening, everybody. Good evening. If I could get everybody's attention, good evening. I'm Sam Moskowitz. I'm the president here at MedStar Franklin Square and a senior vice president with MedStar Health. I get the great honor tonight of kind of serving as the announcer, the executive sponsor of all of our service lines. Gets to lead off great celebrations like what we're going to have tonight. And as the executive sponsor of cancer services here in the Baltimore market, I'm going to have an opportunity to introduce a number of people whose vision made tonight possible with the opening of the MedStar Georgetown Cancer Institute here. So it's my great honor to formally welcome you and introduce you to the MedStar Georgetown Cancer Institute in the Bel Air Medical Campus. If you haven't had a chance to see this campus, please let one of us know and we'll be happy to give you a tour before you leave tonight. This evening, you're going to hear comments from the leadership of the MedStar Georgetown Cancer Institute on the importance of leading the way and offering the citizens of Harford County the most advanced cancer care and treatment right here in the community of Harford County. The Georgetown Cancer Institute, by virtue of aligning with superb clinicians, now will allow Harford County citizens access to a level of academic research and teaching in cancer care that has not been previously seen in this community. With the Georgetown Lombardi Cancer Center, Dr. Lou Wieners here tonight is the director of the Lombardi Comprehensive Cancer Center. It's the Washington, D.C.'s only NCI designated comprehensive cancer center, and it serves as the research engine of the MedStar Georgetown Cancer Institute. And that engine propels centers like our Georgetown Cancer Institute here, gives us the ability to have clinical trials and studies closer to home, not having to drive to Washington, D.C., or even to MedStar Franklin Square down in Rosedale. All of that is available right here on the Bel Air campus. I had the opportunity to meet one of the patients who's a shining example of what it means to be part of an academic cancer center, and one that's very much like what's here in Harford County. This is a gentleman who found us on the web, who was a patient at one of the nation's most notable cancer programs in Texas, and was told by the Cancer Center that there was not much that they could do for him. He called on the MedStar Georgetown Cancer Institute for his care, and I'm pleased that we could have celebrated with him at one of our research symposiums this past year in Bethesda, when we celebrated the research that goes on within MedStar. That service is now going to be available right here in Hartford County. So tonight you're going to hear from a couple of the community leaders, one who had to cancel, so I'm going to ask just one Hartford County representative to speak on their behalf, on behalf of the public officials. And then what we're going to do at the end is actually come back up and unveil officially the name of the MedStar Georgetown Cancer Institute. Now let me call up to the podium Dr. Albert Abulafia, who's the director of the MedStar Georgetown Cancer Institute in the Baltimore region. I have to tell you, I can recall meeting Dr. Abulafia about 4 years ago to discuss coming to MedStar to lead our cancer center at the MedStar Franklin Square campus. I won't steal his thunder, but much of what you're hearing tonight is very much the vision that Dr. Abulafia said to me. He said, Sam, let's not just be another hospital cancer center. Instead, let's build something different that takes the best of breed from academic medicine, from the community, all in a partnership way to benefit the patient. Almost your words to the T, Dr. Abulafia. So tonight, Dr. Abulafia will be joined by Dr. Lou Weiner from Georgetown University, and together those two, along with the faculty in the Cancer Center at MedStar Franklin Square and colleagues throughout the Baltimore region, have been working behind the scenes to put together something that is different, something that is now available to people in Hartford County that hasn't existed till tonight. So let me ask Dr. Albert Abulafia to come up and give us a little bit more about the vision. Dr. Abulafia.
Thank you, Sam. It's really nice to see so many faces join us today for this announcement of really a formalization of the affiliation of the cancer program in the Baltimore area with MedStar Georgetown Cancer Institute. It's really an exciting time for me and for our leadership, and I think for all of the cancer team members, to be leading this MedStar Cancer team in Baltimore for this new alignment with MedStar Georgetown Cancer Institute, and bring so many elements of quality cancer care to the community here in Hartford County. When I did meet with Sam several years ago, we talked about the notion that when I started in practice, there was academic orthopedic oncology, and there was sort of an academic practice, and there was a community practice. And what I realized over time is that not all academic practices that are centered at major university centers are as academic as I'd like them to be. And some of the community programs are actually fairly academic, that they do good clinical research, that they enroll patients in clinical trials, and they're really at the forefront of cancer care. So what I approached Sam about was, how do you build that hybrid model of an academic community program? And how do you bring the value of academic medicine to communities? So we know that that cancer care predominantly involves patients in the community setting, and the majority of patients are not treated at tertiary referral centers. So with this alignment, the intent is to challenge us as providers to really work together as a team to be able to bring outstanding clinical research to the community, to be able to enroll patients in clinical trials, and to be able to provide that care to patients in the community. So this is something that I think leadership has been working on for several years. I know Sam has been part of that vision from the very beginning. I know Lou has been part of that vision for several years, and it's really been a big deal. So this will allow patients in our community to really access internationally renowned cancer specialists, providing the most advanced care for even the rarest of cancers. We now have tumor boards where we can communicate. We have clinical councils in subspecialty areas where we can really be involved at the forefront of things like molecular profiling, which I'm proud to say we were really ahead of the curve. And there are some things that it's symbiotic, where we bring something to the Georgetown Cancer Institute and we get something from them, ultimately for the patient's benefit. And what we can bring sometimes is we're a smaller boat, a little easier to navigate, a little easier to get some processes done, but at the same time we can take the learning experience from the major center, from the Georgetown Cancer Institute, and bring it to us and to our patients. So I really think this is an exciting time for us as providers to be able to come up a notch and really provide and have access to leading researchers in the field of cancer care, to be able to provide that to our community. So to share a little bit more about the value of the MedStar Georgetown Cancer Institute in our community, I'd like to introduce a close friend and a dear colleague, Lou Weiner, who's the director of the MedStar Georgetown Cancer Institute, and I won't mention that it's the only NCI designated cancer center in DC.
Thank you, Albert. Thank you for being a really great partner in this wonderful endeavor. Thank you, Sam, for your visionary leadership in making this happen. And thank you all for being here. I'm especially pleased to see my good friend Steve Evans here representing senior leadership from the MedStar Health organization. I want to tell you a little bit about Lombardi. So Lombardi is one of 49 National Cancer Institute designated comprehensive cancer centers. We've been at it since 1974, so we're not new at this. Our vision is to prevent and cure cancer with a local focus but a global vision. And we've accomplished this through the global impact. We've accomplished this through the work of literally hundreds, if not thousands, of physicians, scientists, nurses, other healthcare professionals who, working together, have really made a difference in the world. So Lombardi is the home of the development of Gardasil, the first human papillomavirus vaccine, whose use promises to save millions of lives around the world, people who will never have to learn that they have cervical cancer or head and neck cancer because they were vaccinated. A wonderful accomplishment. Lombardi is the home for much of the foundational work that have led to the understanding that the cancers of the breast are driven by estrogens, and that estrogen receptor positive breast cancers can be approached and managed in sophisticated ways based upon that understanding. And we've also had a foundational role in the development of what may be the most exciting new treatments in the world of cancer therapy, namely immunotherapy of cancer, harnessing the power of the body's immune system to actually attack a cancer. So the MedStar Georgetown Cancer Institute, which is another enterprise that I have the privilege of leading as the clinical service line for oncology for MedStar Health, can be thought of as the clinical engine for the Lombardi Comprehensive Cancer Center, and conversely, the Lombardi Comprehensive Cancer Center is the research engine of the MedStar Georgetown Cancer Institute. Put those two concepts together and what you have is the ability to deliver tomorrow's treatments today to our patients. And that's really what we're all about. This research-inspired cancer care that we're talking about enables us to really offer the very best to our patients wherever they live. And we work as a network, as a team, where we integrate the work we do not only to develop best common practices of clinical care, but also best common practices for what clinical trials are the most important for the patients we see. How do we make sure that none of our patients are left behind when it comes time for them to be treated with something where there might be a brand new tomorrow's treatments out there for them. It's very important stuff. So what does the MedStar Georgetown Cancer Institute mean for Belair and for Harford County? Well, it exemplifies what we're about. We don't want patients to have to go all the way down to DC or even into Baltimore in order to get treatment they can get closer to home, unless there's no alternative for them. There are times when there's very highly specialized treatment options, sophisticated surgeries such as the kind that Albert does, or pancreatic cancer surgery of the kind that Dr. Evans once upon a time did. And also, novel phase 1 clinical trials that can't be obtained in other environments. Sure, we have to be there for that. But for the other 95% of people with cancer, they should be treated closer to home by the docs they know in the communities they know and love, where they're with their neighbors and their friends and where their families can be with them. And we want that to happen. But we don't want them to suffer by not being able to get the very best possible available therapies just because they've chosen to be treated closer to home. And we believe we can accomplish that. So this is a really important day for the MedStar Georgetown Cancer Institute, because while we've been working at this for quite a while now, I've been working at it for 5-6 years to try and make this happen. And when I moved to DC 10 years ago, this was the vision, frankly, that we were going to be able to do this kind of thing. And it gives me enormous pleasure to be standing here before you today, knowing that this is a tangible example of why this is the most important day moving forward for the patients who live in this area, so that we can put cancer in the rearview mirror for all of us. Thank you very much. Thank you all for being here.
Well, thank you, Dr. Abulafia, Dr. Weiner. I wanted to just take 2 seconds here before I call up one of the leaders in Harford County government to say a few words on behalf of our government here. Let me first recognize one of the members of our MedStar Health corporate executive team, Dr. Steve Evans. Dr. Evans is the Executive Vice President and Chief Medical Officer. So, Dr. Evans, thank you for coming up. I want to also recognize 2 MedStar Franklin Square Medical Center board members. Our Vice Chair, Dr. Dan McLaughlin. Dan, thank you for coming up. And let me also recognize Dr. Mohammed Alabrash, who's also one of our MedStar Franklin Square board members. Thank you, Dr. Alabrash. We have a number of providers of cancer care who are here tonight. I'm not going to name all of you. What I am going to do is ask everybody who is a provider to come on up at the end when we actually take this black cape off and officially unveil the name of the MedStar Georgetown Cancer Institute. So now let me ask Billy Boniface. Billy, come on up. This is a key individual here, administrative leader here up in Harford County. And Billy's going to talk a little bit about the importance of MedStar Health in Harford County. Please.
Good evening, everybody. It's really a pleasure to be here. Anytime Aaron calls me, I always show up. I've had the good fortune of actually, when I served 8 years on the county council as council president, I was involved with the early planning period for bringing MedStar here into the county. And it's truly an honor to have been there when we did the beam signing and ribbon cutting here. And it's a beautiful facility. I'm very proud to have been involved with it from the beginning. I want to bring greetings from the County Executive Glassman, who regretfully couldn't be with us tonight. As many of you probably know, tomorrow is election day. And he, like most of the elected officials, are out and about tonight waving at people coming home and getting ready for tomorrow's election. So, but he did ask me to express how proud he and all of us at Harford County government are of the outstanding resources MedStar Health has made available to the citizens of Harford County since you opened your doors for business. And now the partnership MedStar has created with the Georgetown Cancer Institute will greatly benefit the nearly 1,200 residents of Harford County who receive the daunting challenge of a cancer diagnosis each year. It only further reinforces MedStar's commitment to the county by providing the best possible clinical care and support to those of us that choose to call our home. So on behalf of Mr. Glassman and myself, I thank you for being such a great partner, and we wish you the best success in this year's work.
Thank you. Okay. If I could ask all of our providers of cancer care, could you come forward, please, and join Dr. Weiner, Dr. Abulafia, and Dr. Evans. Come on up. All of our providers of cancer care, we're going to go ahead and unveil the name, please. Afterwards, I'd like to have all of our staff who work in cancer care also to come up for a photo opportunity. Okay? So let's go ahead and step over here. Please, all of our, and you can go by Dr. Evans as well.
I believe so. Dr. McCarron, slide down just a bit.